aqui ao meu lado o presidente da Abafarma, o senhor Alexandre Fabiano Panarello, que se incumbirá de recepcionar o senhor Marco Valla, que nos trará agora a sua contribuição ao nosso evento. Pediria a você que permaneça comigo aqui por alguns minutos, enquanto eu também peço licença aos senhores e às senhoras para falar rapidamente do senhor Marco Valla, que vai, na verdade, fazer uma apresentação sobre o cenário e as tendências mundiais do segmento de healthcare e também HPC. O senhor Marco Valla é co-head do Grupo de Varejo Global do Barclays, cobrindo pelo cargo as empresas de varejo e, como executivo sênior, seu universo de clientes inclui empresas líderes nos segmentos de hardline, broadline e specialty retailers, assim como varejistas de medicamentos. O Sr. Valla ingressou no Barclays em setembro de 2008, no contexto da aquisição da Lehman Brothers. Durante os mais de 18 anos que passou no Grupo de Varejo Global, o Sr. Marco Valla tem desempenhado um papel fundamental no crescimento e desenvolvimento do grupo e participou de mais de 110 transações concluídas através de vários produtos, incluindo aí fusões e aquisições, aquisições alavancadas, dívida, levantamento de capital e produtos, equity linkage, e dentre os clientes selecionados destacam-se CVS Caremark, Home Depot, Best Buy, Toys R Us, PetSmart e PVH. Além de suas responsabilidades no Barclays, o Sr. Valla também serve como líder da equipe sênior do Stanford e da UC Berkeley no recrutamento para Investment Banking. O Sr. Valla recebeu seu diploma com honras pela Universidade da Califórnia, Berkeley. Portanto, a ele, vamos, por favor, dar uma calorosa salva de palmas. Mr. Marco Valla. Por favor.
Gostaria de agradecer, tudo bom? Ok? Gostaria de agradecer, em nome da Abafarma, a presença do Sr. Marco Valla para discutir, para falar sobre um tema tão importante e tão recente que vem acontecendo no Brasil, que é a questão de fusões e aquisições, tanto no setor da indústria, da distribuição e do varejo. Então, obviamente, a sua contribuição para o nosso entendimento do que ocorre no resto do mundo e principalmente no mercado americano vai ser de grande valia para nós todos. Muito obrigado. Thank you very much.
Thank you very much.
Please, thank you.
Good afternoon, and thank you very much for having me today. It's a very exciting time in the healthcare and drugstore industry. Really around the world, you operate in a market which is certainly one of the most dynamic and one of the most growing today, and a big area of focus for many of our clients, both in the United States and in Europe. So we thought it would be helpful if we perhaps spend a few minutes talking about what we see as the industry trends around the world, and then obviously take questions and hopefully make it an interactive session. But a lot of the trends and a lot of the themes that we're seeing globally, I think, are quite relevant to many of the industry changes that you're experiencing here in Brazil today. So hopefully there are some interesting lessons and themes that we can speak about. So first, just quickly on a global perspective, obviously the themes are quite different from country to country, but I think there are a few common trends that are very relevant all around the world. The first is really an aging population, which is particularly relevant in Europe and in the U.S. and is driving a lot of the growth that we're seeing on the prescription side, just the increased demand as many of these markets, frankly, are becoming older and older and people are utilizing more drugs. The second point, which you're experiencing yourself in this country, is the proliferation of generic drugs and the impact that that's having really across the industry when it comes to demand, when it comes to reimbursement rates, when it comes to the gross margin structure of our various retail clients and how to best address gross margin pressures as generics become more and more relevant. Now, the good news is that they help drive traffic for the most part, but it clearly has economic implications on the business model that many of our clients are thinking through and struggling with. Thirdly is the theme of private label, which is very, very relevant in the U.S. and quite relevant in Europe as well. More and more retailers are looking for a way, again, of differentiating themselves and trying to protect themselves on the margin side by having a greater penetration of private label, their own products, differentiated products, another way of enhancing the brand, and obviously another way of enhancing productivity and profitability versus some of the national brands. And then last but not least, it's really a question of what do you want to be to the consumer, and how do you touch the consumer across as many channels and across as many services as possible. So, for example, we are seeing more and more direct sales. We are seeing more and more phone order, kind of direct shopping from that perspective. In the U.S., it's less relevant here in Brazil, but in the U.S., a big part of the product offering now is actually food and convenience items, which you're not allowed to sell here in Brazil. But if you come to any U.S. drugstore, you will see that a big piece of the offering now is actually food, convenience, general merchandise kind of items. And then beauty, which I'll speak about for a couple of minutes, but certainly the beauty products and the higher end beauty and wellness offerings are becoming more and more relevant to drugstore companies around the world. So I think all of these different themes, again, when you combine it with margin pressures, the wholesalers, the different dynamics that you have in the industry, they're leading to more consolidation, which again is very market specific. Certainly in the U.S., we've had a lot of integration across the industry in the last several years. You are getting, in the U.S., again, more pressure on the PBM side, which I'll speak about in a couple of minutes. And then hopefully over time we're going to see more globalization. We haven't seen as much of that so far, but there's a lot of talk of European and U.S. players becoming more relevant in emerging markets and just a greater globalization of the industry over time. Specifically on Europe, for a couple of minutes, when you look at the European landscape, again, it varies very much country by country. One of the structural challenges that we have in Europe is that in most countries you cannot consolidate chains, drugstore chains. It's very much a country-by-country specific scenario, but in most places outside of the UK, there are actually a fair amount of protectionist laws that effectively protect the individual, the local retailers from consolidating one with the other, which has made the consolidation across Europe quite challenging, and it's a real structural issue now as you're getting more pressure from wholesalers and I think a greater desire overall for some of the bigger chains to become pan-European in nature. That just hasn't been allowed by the European Court of Justice. It's one of the key dynamics that people are looking at and seeing if those laws will change over time. Secondly, just given how relevant the governments are in Europe when it comes to healthcare reimbursements and just who ultimately pays the bills, the austerity measures that have been put in place over the last couple of years are starting to have a very significant impact on profitability margins and how these companies are being managed, which again is leading some to want to pursue more consolidation, but as I said, it hasn't been as achievable as some would have liked. But certainly the austerity measures, across Europe, it's been very relevant in the UK, it's been very relevant in France, it's becoming more relevant in Germany. It's having a very negative impact on the industry in many of these markets. And so as you think about, what that means, again, the wholesalers, for the most part, have integrated wherever possible, and we're starting to see more and more of a focus on not just greater wholesale consolidation, but potential integration between wholesale and retail. Retailers are pushing over-the-counter, front-of-the-store products, again, as a way of differentiating themselves and as a way of enhancing margins. Private label, which I mentioned before. Internet, on average, you get about 500 basis points higher profitability through an internet sale versus an in-store sale, so a very significant push on the multi-channel side of the business. Greater services, more consultations, more frequent touch points with the consumer. And then, as I mentioned, wellness and beauty is a real way of trying to differentiate yourself. When we think about Europe going forward, again, most people think of Europe as a very mature market, and it is for the most part. But as we think about what could be growing Europe, the European drugstore landscape over time, it's really a few dynamics. One is consolidation. As I said, I think there will be hopefully more consolidation going forward as some of the rules change, but that's something everybody's focused on. Secondly is the proliferation of specialty drugs. Again, greater margins, greater service, more touch points with the consumer. Generics are incredibly relevant there, especially now with governments being under the pressure that they're under, pushing generics more as a way of lowering their reimbursement costs. I think you're only going to see more of that going forward. And then private label, as I said, is a real core competency, and the chains that are doing better in Europe right now are those that are truly fully integrated when it comes to the supply chain and have a very differentiated and value-added private label offering. I think going forward, as we think about what could happen in Europe, watching the Eurozone, generally speaking, from a macroeconomic perspective and the austerity measures and how those play out over the next 12 to 24 to 36 months will be absolutely critical. Retailers are looking to maximize traffic any way they can. You have companies like Boots, for example, in the UK that are selling mother care baby apparel as a way to get the mother to come into the store, buy some well-branded apparel offering for their children, at the same time buying more traditional pharmacy products. So looking really for any way of driving traffic and being able to get people into your stores more frequently. Hopefully there will be more consolidation as some of these players are looking for greater and greater scale. And then the two questions here at the bottom of the page, from my role on the investment banking side, these are really critical questions in terms of consolidation around the world. Will you see more integration between the U.S. and Europe, especially on the wholesale side? There have been all sorts of rumors about that. And then secondly, again, how do these players in the mature markets in Europe and the United States, how do they think about emerging markets, both here in Latin America and in Asia? Everybody's looking for growth. As I said, you're fortunate enough to be in a market that is growing organically more than most. And so, again, our view is you're going to see more cross-border penetration over time as people are looking for any potential growth opportunity they can. Spending the rest of the time just on the U.S., as we look at the landscape in the U.S., I think the first point to make is just how large the U.S. healthcare industry is. Last year, $2.7 trillion were spent on healthcare products and services. That's almost 20% of American GDP. That's versus 11% in France, 10% in Germany. It's by far the largest healthcare market in the world. For the most part, again, it is mature, although the growth dynamics within it are changing quite rapidly. It is a very consolidated market. Everybody looks to the U.S. as an example, I think, of what consolidation could become over time as you look at the drugstore industry in Brazil and obviously in Europe and other places as well. But just to put it in perspective, in the last 7 or 8 years, we've gone from 8 to 10 players to basically 3 national players. The top 3 players control almost 45% of the market at this point. So there has been tremendous consolidation on the retail side, and recently tremendous consolidation on the PBM side, which again is very relevant just given how the healthcare industry works in the U.S. When we look at the current environment in the U.S., I think there are a few key questions to think about. The first one, again, is the integration that we've seen. On the PBM side, which I know is less relevant in Brazil, but it's very relevant in the U.S. given that all disbursements, for the most part, flow through the major PBM players. In the last 3-4 years, you have seen CVS acquire Caremark. That was the first real integration that we saw between a drugstore player and a PBM player. In the last 12 months, you have seen Express merge with Medco, now creating the biggest PBM player. And then most recently, we had SXC and Catalyst, which were basically the number 4 and number 5 players coming together. So there has been tremendous integration on the healthcare drugstore side as well as on the PBM side. And a lot of questions going forward about that relationship between PBM and drugstores and who has the ultimate power and how do you manage the profitability structure between those two competing forces. That's probably the most relevant question in the U.S. healthcare industry today. The other big question, obviously, from our perspective is kind of the politics around the healthcare law. The Supreme Court will be opining on that either this week or next week, so you're going to see something very soon as to whether that law will be sustained or not. Just to put it in perspective, there are about 50 million Americans that don't have health insurance, and if the law is passed and upheld by the court, effectively every American will be forced to buy health insurance by 2014, which will drive an incredible amount of demand for healthcare-related products. Medicare and other patients as well will be spending a lot more on healthcare than they have historically. So everyone is watching that decision very, very closely. And then again, this integration, which I'm sure you've talked about in your sessions today, but this integration between wholesale and retail, wholesale and PBM in our case, how to provide a full service solution and how to integrate yourself as much as possible, both vertically and horizontally. I think those are pretty advanced themes in the U.S., probably more than in most other markets, and it's interesting to see just how much the industry has evolved already from that perspective. It's still very much an industry in transition, and one that we think will have some more significant transformational changes over the next couple of years, again, partly based on what happens out of the Supreme Court. The key trends that are driving the business in the U.S. right now are, first and foremost, aging population, which is very relevant in the U.S. Senior citizens are 14% of the population today. That's going to go up to about 20% by 2030. So, again, very significant demand coming out as the population ages over time. The generic mix in the U.S., this is striking, I think, to most people that don't follow the U.S. very closely, is just how penetrated generic drugs have become over time. It's now close to 3/4 of all prescriptions in the U.S., versus 20% about 25 to 30 years ago. So very, very significant shift towards generics, again, in part driven by the reimbursement rates. To give you an idea, a typical copayment on your insurance on a typical generic drug is kind of $10 to $20. If you're buying the branded drug, it can be anywhere between $30, $40, $50, up to $80, $90. So there's a real economic incentive for people to shift to generics, and for the most part, nobody thinks about it anymore. It's just a very natural trend in how the U.S. consumer shops for drugs. Specialty drugs are becoming increasingly more prevalent. It's really the highest growth part of the drug business in the U.S., growing at close to 20% a year at this point. Obviously much more profitable, much more differentiated of an offering. And the next interesting dynamic there, which we're starting to see out of Europe, is biosimilars, so generic specialty drugs, which right now are not allowed in the U.S. They are allowed in Europe. We expect them to come to the U.S. by 2017, and that will be, in our view, a very significant driver of further growth going forward. So between the demographics, some of these new products, some of the new drugs, again, that's where the growth in the U.S. Is really coming from, although the U.S. market itself is obviously not growing the way the Brazilian market is. Health and wellness, it's something that drugstores are focused on more and more. Again, it's higher margin. It's a way of differentiating yourself with the consumer. It's a way of being more value-added in front of the consumer. So you'll see a lot of these stores. CVS is a good example of one who in the last few years has shifted their focus much more on health and beauty kind of products. Mail order and online, as I mentioned, significantly more profitable and a big area of focus. Government, we'll see again what happens there, but especially for Medicare Part D, if the law remains as it is, there will be significant incentives for seniors to buy more drugs. It will really drive that part of the business much more materially than it has in the past. It will cover all seniors, whether you're employed or unemployed. So that's something that people are very much focused on in terms of potential incremental demand. And then front end of the store, which again, it's less relevant to how your market is today, although your market may develop this way over time. But our drugstores are as much about the front part of the store, the food, the convenience items, as it is about the prescriptions. And more you're seeing a greater focus on that. The market, as I mentioned, is really dominated by CVS, Walgreens, and Rite Aid today. If you look at some of the names here on the left side of the page, those were very relevant chains over the last several years, which have been acquired mostly by CVS. Duane Reade was acquired by Walgreens, but there has been very, very significant integration. For the most part, these stores have been rebranded. Again, it's all about getting incremental synergies on the back end, having more purchasing power with the wholesalers, having more purchasing power with the PBMs, and really trying to build as much of a gorilla as possible when it comes to the drugstore side of the business. You know, an interesting case study here when you think of the friction between drugstores and PBMs is what happened in the last year between Walgreens and Express Scripts, which some of you may have followed. But Walgreens and Express Scripts effectively came to a disagreement where they would not agree on the appropriate reimbursement rates, and Walgreens opted out of the Express system, and it's having pretty significant repercussions on their own business, since every Express customer now has to go to a CVS or a Rite Aid to fulfill their prescription instead of going to a Walgreens, and it's having an impact not just on Walgreens prescription sales, but also the front end side of the business, since no one is walking into the store to get their prescriptions filled. So I think it's an interesting case study of really how dependent the two are on each other. And when you look at what CVS has been able to do with Caremark, I think it's a good example of having that holistic solution, that full service solution between one piece of the industry and the other, and offering really a solution that's good for the consumer and good for the company. To put it in perspective, these three chains combined have about 20,000 stores. So one of the most penetrated channels of all of retailing in the U.S. About 2/3 of the business is still prescriptions. About 1/3 is the front part of the store I was talking about. And then just one other dynamic to touch on is the in-store clinics, which is actually a very relevant trend in the U.S. right now. As hospitals are really overused, there's very limited excess capacity at this point. The hospital structure is under immense pressure as more and more people are in need of health care and not enough hospitals are being built or expanded. You have seen both CVS and Walgreens especially expand on the clinic side and offering hospital-type services, obviously for the more basic issues, for people to just walk into the store and get care that way instead of walking into an emergency room. It's more affordable, it's easier. For the very simple problems, it's just a more efficient way of a patient for being served. And it's a great way for CVS and Walgreens of capturing that customer, getting the patient through the door, providing the service, issuing the prescription, and making them a customer, hopefully for life. So you have seen, very significant penetration there. There are about 1,300 clinics in the U.S. right now that operate primarily through CVS and Walgreens, and there's potential for about 5,000 clinics across the U.S. So that's one of the bigger growth initiatives, I would say, that these chains have. For those of you who haven't been to the U.S., this gives you an idea of what some of the stores look like. Again, less of a focus on pharmacy, less of a focus on beauty, I think, than some of the chains you have here, although they're expanding the beauty offering. Much more of a focus on food and beverage and convenience, as I said. On the PBM side, again, there has been significant consolidation, continued focus on improving the quality of care, continued focus on trying to lower healthcare costs really anywhere you can, significant focus on controlling the mail-order pharmacies, which, as I mentioned, are highly profitable and a big part of the driver of the business going forward. And again, a very significant focus on generics and getting your patients to really buy into the generic side of the business. On the U.S. government and the proposals that are in place, again, we'll get a ruling, as I mentioned, hopefully in the next few days. It will be very, very material. Just on the Medicare Part D alone, the new law would provide a 75% discount on drugs for anybody in Medicare Part D. And again, it will ensure all senior citizens, whether you're employed or unemployed. So when you think of the senior citizen population, that 13-14% of the country that I was talking about, now having access across the board to drugs they don't have access to today at a 75% discount will be a very significant driver of business for the healthcare industry, again, assuming that law is passed and remains in place. The other big area of focus will be technology investments. That's one area where I think the U.S. has been a little behind. You know, you look at e-prescriptions. We show you a chart here of how e-prescriptions have grown from a very negligible number 5-6 years ago to over 300 million e-prescriptions today. The new healthcare law would dictate significant technology investment to making sure that that's one piece of the business that doctors are rolling out and focusing on much more extensively, as well as electronic health records, again, as a way of making the whole system a bit more efficient, hopefully, and transparent for the consumer. So much more of a focus, I think, on making the industry more economically focused over time. And then lastly, just on the beauty trends for a couple of minutes. Again, a very significant focus on beauty. The one challenge that beauty has in the U.S., which you don't have as much here in Brazil, is that most of the high-end brands, most of the well-known beauty brands, will not sell to drugstores. They sell to department stores, they sell to specialty stores like a Sephora or an Ulta, but they don't sell to drugstores. And so the drugstores over time have been trying to get those vendors to sell to them. CVS, as I mentioned, tried this boutique, it was called Beauty 360, to sell basically higher-end beauty products in an adjacent store as a way to try to get the vendors to come in and really purchase from that environment. And it's been a challenge. So there has been, I think, a very significant strategic focus in trying to grow that business over time and try to take some of the market share away from the department stores and some of the specialty stores who right now make a lot of money in that business, and they see much more of a repeat business than the drugstores do. So focus on premium products and trying to take some of the market share away. Again, a big driver to that will be whether or not the vendors play along. But as you can see, the penetration here of beauty products for the drugstore channel really hasn't moved very much in the last few years. It's gone from 14 to 15%. So for the most part, you still have drugstores looking, to sell those products, but hasn't really been as successful of an initiative as others. The mass market continues to do a lot in beauty, but at the much lower end, obviously. And then the specialty stores are really the ones that are gaining share. You look at chains like Sephora and Ulta, they've added hundreds and hundreds of stores a year for the last several years, and that's really the piece of the market that's been growing. So as you think about the industry over time, I think that's an advantage you have here, is how much more penetrated I think beauty products are in many of your drugstores versus the U.S. and even other chains in much of Europe. So certainly the industry remains very much at a turning point. We do expect more consolidation going forward, as I said. We do expect a greater integration of services going forward. And hopefully we'll see more cross-border activity as people look at markets such as yours as a way of growing and as a way of penetrating what's obviously a very compelling demographic opportunity compared to many of their home markets. So with that, I'm happy to open it up for a discussion. Any questions you may have? Perfect. No, thank you very much. I just want to thank you again for inviting us today. Appreciate it.
Nossas mais sinceras congratulações e agradecimentos ao Sr. Marco Valla por sua apresentação e contribuição ao nosso evento.